Video is just to give you a basic understanding about a tattoo infection and how to deal with it. Now, first thing, if it's how to spot it, is I'm going to show you this. This is how I wrapped it. I'm going to go over how to do this in a second. But now I have this tattoo here, which is healed a long time ago. Oh, I could even use this one, it'll be easier. And you see there's no redness around it. Now, if a tattoo is affected, it's going to be red around it. And what to watch out for is if you get it red after the first day, that's normal swelling. But it should be going down in size. Now, if it's going up in size and the redness is spreading, that's an infection. And you have to get it treated with antibiotics, because if it gets into your blood, you can get very, very sick. Now, what happened with this arm is I didn't follow the aftercare instructions properly, and I scrubbed it too hard, which caused the ink to react. I think it was a little bit of an allergic reaction with the color dye, so it started spreading. I actually went to the hospital, got an IV of antibiotics. They put me on these oral antibiotics now, and I take one 4 times a day. Now, just getting into how to deal with it and aftercare. First thing is you want an unscented soap. Dove is very good. Unscented soap, and you want to be very gentle on it. You don't want to pick it, and if you absolutely have to pick it and you can't control yourself, make sure you have 100% clean hands, otherwise it's going to get even worse. So the first thing is unscented soap and lightly rinsed, no scrubbing. Now, the second thing that all tattoo shops that I've been, they always say unscented Lubriderm. Now, unscented Lubriderm is good, but don't scrub too hard to rub it in. Now, the first thing I do, this is the steps that I do. I come out of the shower after lightly rinsing it with this. I put a little droplet about the size of a nickel on the tattoo, depending on the size of the tattoo. Something this small would only need like a tiny bit. This one was a bit bigger, about the size of a nickel. Then I rub it in. I let it soak in and dry for 10 minutes or so. Then I come back to the washroom and I start the process of wrapping it up. Now, I'll tell you why I wrap it up. Why I wrap it up is I'm using polysporin and petroleum jelly, which is like a, Vaseline, like Vaseline, which won't dry and will stay on there, which it keeps it moist, which prevents further infection, but because it keeps it moist, dirt will cling on easier, so you have to wrap it up. Now, this is something that was recommended by the tattoo shop. It's called Bactine spray. Not recommended by the pharmacist. The pharmacist says it might actually dry it out and make it worse. But I'm using it, and since I've been using it, the tattoo has been healing better. So I spray it 1, 2, 3, 4 times, just, you know, on there, and it cleans it out. It's basically it relieves burns and minor scrapes, insects, bites, such things like that. Medical ingredients are on the back. If you go and talk to your pharmacist, I'm not going to read it to you. Then what I do is I let it dry for a little bit. I put on polysporin. Okay, just an antibiotic ointment, and I put it on. And then the last step is I take this petroleum jelly. Vaseline works great, except the reason I have this instead of Vaseline is Vaseline, they come in a little tub and you scoop and put it on, scoop and put it on, so it might, you get some dirty stuff into the Vaseline container. So this squeezes out, it's less likely for an infection, which I already have. An antibiotic will take care of it, but I don't want to make anything worse. So I just put that stuff on, and I smear it around and make sure it's nice and gooey. I take out one of these first aid pads Johnson & Johnson. Make sure it's a non-stick pad. Even though you are using lots of Vaseline, still make sure it's a non-stick pad, because you don't want to rip your skin off after you take it off. And then just some basic gauze, and you wrap it up, and you put some tape on it, just like this. And I put on 3 pads, and I taped it really securely so it won't slip. Because if you're using this much Vaseline and this many lotions, it's going to slip all over the place, so you have to make sure it's secure. You can sleep in it, you can go out in it, it's all fine. I've had this bandage on probably for about 2 hours now, and I'm going to keep it on for another 6 hours, and then I'll go to bed and I'll sleep with it on. I'll wake up tomorrow. If it's still on, that's great. If it fell off, I'll do it again. So this is the tattoo infection video. The update on my tattoo is it is healing. It's healing slowly. The redness is going down slowly. It's going to be about a month before I fully recover from this. It's been a scary experience, and just shout out to all you people getting tattoos, and make sure that you get them done at a professional place that's clean. Make sure that you know your aftercare instructions, and if you mess up for any reason, this video should help you out at least a little bit. But before anything, go to your doctor, go into the tattoo shop, talk to them as well. Let them know you had a bad reaction to it, and hopefully this is just that little extra piece of information that will help you out. Thank you, and enjoy your day.